Thank you very much, Ruth. Yes, I'm James Bolton, the Director of EBCam, and I'm joined by Steph today as well. And we're going to be covering a number of different topics over the next sort of 45 minutes or so. As you probably know, EBCam are a specialist employee benefit consultancy. We provide a wide range of support to clients throughout Cambridge and nationally in all respects of different employee benefits. If there are any individual points that you want to raise during the session, please feel free on the chat box to put the questions through to us. And we'll try and possibly deal with one or two of them. Steph, I think, is going to be getting the questions. I don't think I can see them at the moment. So Steph may interrupt and we'll try and answer them as we go through. But also, if time allows, have a bit of time at the end to answer one or two of them, and we'll also do a Q&A sheet following the session, which I'm sure Cambridge Network will kindly send around to everyone, and that will sort of give a more comprehensive answer, no doubt, to each one of the questions that is raised. I'd also like to say that I really appreciate you joining us today, because there's so much uncertainty in the world at present. And I know you all have sort of personal, individual pressures and different circumstances that you'll be under. And I also appreciate that HR teams in particular across all businesses are very busy supporting their companies, their exec board and their employees across all sorts of different issues, from wellbeing issues, financial issues, and no doubt having to cope with the new furloughing rules that seem to sort of shift and change every day. So thanks for taking the time to join us over the next hour or so. So if we come on, yes, to the next agenda we're going to be covering, we're going to be talking a bit about pensions, because obviously you'll have qualifying workplace pension schemes. All the members, all your employees will be members of those schemes. And I don't know if you've had a chance to look at your pension statements recently, but I know mine, and I know pretty much everyone's will have been hit quite hard by the current crisis. So we're going to be talking a bit about investment markets. We're going to be talking about furloughed employees and pension contributions and auto-enrolment. We're going to be looking at salary sacrifice, because that does add a complexity to the situation as well. Steph is then going to be talking about risk benefits, including group life, income protection, critical illness, key person assurance, and then moving on to health and well-being, and how the pandemic and the crisis is sort of impacting on private medical insurance policies, health cash plans, how they can be used, and employee assistance plans. And we're also going to be touching very briefly on flex benefits and some of the complexities that flex benefits might have to cope with in relation to some of the policy changes and so on. I'm going to then mention employee support and communication, because as I've said earlier, I know HR teams are providing tremendous support to all their employees at the moment. I know you're all very busy, but there are certain things maybe that can provide support by using the benefits and promoting the benefits across to your employees. And then we're going to be wrapping it up, looking into the future very briefly and taking some questions. So moving on to the first topic of pensions. I've attended a number of different investment seminars over recent weeks, and some of them very technical, and some of them trying to sort of see value in these very difficult times. But most are very cautious about their predictions, and rightly so, and sort of what might happen in the future. I watched the news yesterday with amazement, as I'm sure you did, about the Texas oil price collapsing, and oil futures now being sort of minus $30, $40 because they haven't got the storage. And you know, it definitely is strange economic times that we are living through at this point in time. There are so many unanswered questions. You know, we don't know how long the global lockdown is going to last. We don't know when a vaccine might be available to take us through this period of time, and we don't know whether there's going to be any later outbreaks or repeated lockdowns in the future. And in any case, even when you do unlock the world in the global sort of interconnected economy, how can we get supply chains, manufacturing, consumer demand all up again to the state they were previously. So it's a very complex area, and it obviously doesn't have a simple solution. But many commentators are predicting a V-shaped recovery, so a rapid recovery as soon as we get back to the new norm. And that's no doubt what we'd all hope for, but it's by no means certain. I mentioned the oil price, and Goldman Sachs said that this is the largest economic shock of our lifetimes, and it will permanently alter energy markets. And I can see that, business flights, we're all doing many more meetings like this. We're doing many more sort of Skype meetings. So will business travel and the profits that delivers to the airlines sort of ever return to normal? Will energy use ever be back to the same position? And clearly the climate change goals that every country pretty much has put in place, that's the one positive impact about this situation, is the fact that there's significant reduction in pollution. Hopefully it will strengthen people's attitudes as to why social responsible investment and considering climate change within some of these questions will be important. So there has been a rally in the markets. The low was on the 22nd of March, or the low to date is on the 22nd of March of the FTSE 100. And from that low, the markets have recovered around about 15% growth from that day, from just under 5,000. But we're still about 24% lower than the highs of the market that we had in January. And the one problem is we don't know to the extent of the recession and the market falls, and therefore, as I say, many commentators remain very cautious. So has the recent recovery been premature, and will there be a U-shaped recovery, and is there further pain to come? Well, no one absolutely knows. If we go on to the next slide, one of our risk warnings in financial services, and I know that there's a few financial service people on the call who will be very familiar with this, is past performance and not necessarily guide future performance, which is quite right, but past performance is something that can be helpful. And I thought this was a useful slide. It's slightly out of date in that it assumed that the low was the 15th of March. Well, it wasn't actually the bottom on the 15th of March. And indeed, as I mentioned earlier, we don't know when the bottom will actually hit, because this is clearly an unprecedented situation and we're not through it yet. However, it's useful to see that the depths and lengths of previous falls and the speed of some recoveries. So the dot-com bubble is one of the first that I remember very, very well, from March 2000 to October 2002. And that led to a recession, led to a significant fall in the markets of about 49%. But when markets did recover and did take the upturn, over the next 250 days from the bottom of the market grew by some 38%. Again, the more recent one that we're all very familiar with is the financial crisis of 2008. That led to a market fall of about 57% from the bottom in March 2009. But then it had a very, very quick recovery from that point over the following 8 or 9 months, and grew by about 60–70%. So I hope this gives some comfort that investment markets can and do recover, and can do recover quite quickly. However, as I mentioned earlier, we don't know the full economic impact of the current crisis and the length and depths of it. And yeah, past performance isn't necessarily guide to future performance, so I'll just express some caution. But there is always some light at the end of the tunnel. So what can you do to support the employees about the markets and the investment volatility? Well, mostly it's making sure that you're making use of probably what's there in any case. So your pension provider will provide significant support. Your advisors hopefully will provide support in providing information on the investment markets and how these what these are doing at the moment. You can consider the default fund performance, and it's well worth contacting your pension provider and getting information about what is your default fund, how is it performing, how is it standing up to the current volatility in the markets, and in time also considering then whether the default fund is the appropriate one. There is pressure from younger employees to consider socially responsible investments. And indeed, I know the CBI were at the conference, which was going to be held in Glasgow in November, and hopefully it still will be, going to be putting suggesting to companies that maybe they should consider a socially responsible investment as the default fund for their qualifying workplace pension scheme. So it is a good time just to step back, gather some information about your investment performance, your default fund, and consider whether it remains appropriate. But educate your staff, offer them information, advice. There's a lot of planning and tools that are available through your providers' websites that should give them information about how to switch funds, the performance of the funds, and I know that a number of them have come up with short videos explaining volatility and risk and reward, because clearly the markets are at a low point. It's not necessarily the right time, therefore, to take the money out of risky funds and become more cautious, because then when the rebound does come, then people could miss out on that. But clearly it depends on someone's attitude to risk, their risk profile, and how long they've got to retirement, and how they wish to retire, which will determine what's appropriate for each individual. So coming on to furloughing. Well, this is a topic that is really hot in the news. From yesterday, 6 o'clock, I think it was yesterday morning, the website went live to actually be able to claim for your furloughed employees. And the government and the pension regulator both published some helpful guidance over recent weeks on how pension contributions should be calculated for furloughed workers, and have provided some supporting examples. So to ensure you're paying the correct contributions, you'll need to consider what is your definition of pensionable salary on which you calculate and pay your pension contributions. Is it qualifying earnings? Is it basic pay? Is it total earnings, or something else? And the definition that you're using for your pensionable pay and your contractual obligations will then determine how you should calculate your employer and employee pension contributions. But if it's basic salary each month, then if reducing your furloughed salary to 80% through the grant, then it may well be appropriate to reduce your employer and your employee pension contributions proportionately as well. But you'll have to remember that you can only reclaim 3% of your qualifying earnings for the period as the employer pension contribution. So even if your scheme is using a more generous salary definition or a more generous percentage contribution, you're only going to be able to reclaim 3% of qualifying earnings for the period in question. So if you were paying someone the full £2,500 grant for qualifying earnings, this would mean that the qualifying earnings for the period would be 1,980. So that's 2,500 less the £520 lower earnings limit from 6 April 2020, and 3% of that figure of £1,980 is the £59.40. So that's the maximum grant for the pension contribution which you're going to be able to reclaim in that month. It's important to also remember that there's no automatic change. So if you've been furloughing employees, there's no automatic change to the contract of employment. And it doesn't necessarily therefore follow that you can therefore automatically reduce the pension contributions to which those employees would be due. So to make changes to the definition of pensionable salary, or indeed the level of and the percentage of employer contribution, you would normally need to consult with the affected employee listed change by the pension regulator. And if you have more than 50 employees, it would normally require a 60-day consultation to actually reduce the level of contributions or reduce the definition of pay. However, the pension regulator has recently provided some helpful guidance in the fact that subject to your scheme documentation, your contractual obligations, they won't take any action against you if you were to reduce the level of employer contributions or indeed increase the employee contributions, so long as certain criteria were met. And these are quite specific. So you've furloughed these staff under the job retention scheme. You're only reducing the employer contribution for these staff and not non-furloughed staff. You're only applying the reduced rate for the furloughed period, and then it will revert back to the current rate. So it's not a permanent change. And you've written to those staff and described the changes and the effects on those staff. So long as you fit those criteria, then it is possible for furloughed staff potentially to change the contribution basis. But you should also carry out as much consultation as you can, given the circumstances which you're in at the present time. And all other auto-enrolment duties remain totally unchanged. There's no change to automatic enrolment duties in any respect. So the assessment of workers, the opt-out processes, the re-enrolment rules, the declaration of compliance, etc., they all remain exactly the same. And I'm sure you're all involved in some way with furloughing workers, and therefore you're aware that the calculation will normally be based on regular wages as at the 28th of February. But if you use salary sacrifice, it can become quite a bit more complicated and potentially a bit more expensive for the employer. As an employer using salary sacrifice, firstly, you can only claim 80% of the post-sacrifice salary for the furloughed income grant. So you can't take into account the fact that you were making a salary sacrifice and therefore reducing the employee's wage when you're calculating the 80% income grant, or calculating indeed the 3% employer's qualifying earnings pension contribution which you can claim. So you must continue to pay the total contribution, the total pension contribution due, and any other benefits that you're liable to under their contracts, which will usually mean that you'll need to continue to pay 100% of the pre-furloughed employer contribution, which would include the sacrificed employee contributions. So for example, if you were paying a 5% employer contribution and say a 5% employee contribution via salary sacrifice, the employer will still be committed to pay a 10% employer contribution, quite possibly calculated on the pre-sacrifice and pre-furloughed reference pay for that individual. And you can't make a deduction from the 80% of the wages paid under the job retention scheme to cover the additional pension contribution because of these salary sacrifice arrangements. So you'll need to review the legal documents, you need to check your contracts, you need to check the salary sacrifice agreement, because that actually forms part of the individual's contract, to determine whether you're actually what you need to do and whether you can make any changes. However, if you are topping up the employee's wage, so say you're not paying just the 80% job retention grant, but you're paying 100% of wage, so you're making a top up of 20%, then you can actually make the salary sacrifice reduction from this top up payment in the usual manner. But obviously you can't go below the 80% grant. It's quite complex. And as I say, it does mean probably that salary sacrifice arrangements will be more costly in this one time, for this short period of time for furloughed workers, because they'll be responsible for paying the full employer pension contribution, which effectively includes the employee's salaried sacrifice amount as well. So other salary sacrifice contractual benefits should be maintained in the normal ways, like cycle to work or childcare vouchers. But HMRC have agreed this pandemic counts as a lifestyle event, and employees may wish to change their salary sacrifice selections where the rules or the schemes can allow them to do so. However, for furloughed workers, it may be unlikely to be in their interest to do so. So care would need to be taken and checking contractual agreements and salary sacrifice wordings, which may also state for how long the sacrifice should have applied for. So some employees may decide to opt out of salary sacrifice, or indeed opt out of the pension scheme altogether due to their financial situation. But you must take a lot of care as the employer not to ensure that you're not incentivizing, encouraging or promoting this to employees in any way. Clearly, if they come to you and they want to opt out of the scheme or opt out of salary sacrifice, then they can do so, but the company mustn't be encouraging them to do that. So it's a bit of a whiz tour of pensions and furloughing, but I think we're still on time, which is good. And I'll now hand over to Steph, who's going to talk about some of the other aspects and some of the other employee benefits.
Perfect. Thanks, James. Just a reminder, if anyone has got any questions, if you do want to send them through the chat functionality, as James said, we'll try and pick some of them up, but we will follow up with any FAQ document. Similarly, our contact details are on the end of the slide. So if there is anything that anybody wants to pick up separately offline, then James and I are more than happy to pick up on any questions that you've got afterwards. So for the purpose of what I wanted to cover off, as James said, I'm going to go into how employee benefits actually can be impacted or have been impacted as a result of the situation that we all find ourselves in. Starting with group life assurance, it's likely that many of you will have a group life assurance policy in place. Deaths from coronavirus should be covered under any group life assurance scheme that you have got. It will be subject to the policy conditions, which you should have a copy of. It's just important to make sure that there wasn't anything, I guess, any underlying condition that could be deemed to have not made the death from coronavirus. But ultimately, so long as an individual's death certificate states that was the cause of death, then it should be covered by any group life assurance scheme that you've got. It is important to bear in mind, though, that if you have any employees, which I think is probably highly unlikely given the fact that nobody can get anywhere at the moment with none of the airlines actually in operation or very few flights, that if you have employees who do travel against Foreign Office guidance, it's highly unlikely they would be covered under any life assurance policy. So it's just really important to bear that in mind. Also, any catastrophe limit or single event limit that you might have on your policy, it's normally quite a substantial figure, but if you are quite a small business, the group life assurance providers have confirmed that this is something that has activated that catastrophe limit. So it's worth just bearing in mind that if you were unfortunate enough to have many deaths, it may well trigger that catastrophe limit. In terms of group income protection and group critical illness, we kind of felt it was important to include these, but coronavirus itself isn't a critical illness, and the illness or the suffering from that illness is unlikely to continue with symptoms beyond an income protection deferred period. Obviously, the virus is impacting people in very, very different ways. For those people who are very poorly, clearly they are off work, but for many people they are actually contracting the virus, but they're still able to continue to work. So it's unlikely that coronavirus is going to have an impact on either of those schemes, but we felt it was important just to include those. A few points to make, which is they're kind of applicable to all risk benefits really. First of all is actively at work declaration. So as long as somebody is healthy, even if they are being furloughed, then they would still be deemed actively at work from the insurer's point of view. So long as they haven't been given any medical advice that they are unfit to work through either physical or mental health, then they would be deemed actively at work for that period whilst they are being furloughed. It's important at renewal to just make sure that you still use an individual's pre-furloughed salary. The providers, again, many of the providers have confirmed that is the level at which somebody would be covered, for example, under a group life assurance scheme. So even if somebody was taking 80% of their pay through the furloughed scheme, if they were to unfortunately pass away, then they would be covered at the pre-furloughed salary amount with the multiple of salary that's applicable to your scheme. It's also really important to consider with any existing schemes that you've got your cessation ages and eligibility ages on any schemes that you've got. So most schemes would have perhaps 16 to state pension age as the age that they would cover an individual under those schemes. but it's worth just making sure you haven't got anybody that sits, for example, over the state pension age or over whatever the cessation age is that you think is covered that subsequently might not be. It's just really important to make sure that actually now that's being reviewed. And also the eligibility. So if you've got a group life assurance scheme and you're assuming that all of your employees are covered because you've given the data that covers all employees to your broker, for example, actually making sure that the policy itself stipulates that all employees are covered and there's no restrictions or caveats, just so that you've got everything sorted in the event if there were to be a claim. Policies will have a limit as to what you an individual can automatically claim for, so free cover limit under a policy. Anything over that, which tends to be higher earners, for example, on a group life assurance scheme, providers may need GP reports or medical evidence. It's worth, again, just taking into consideration the fact that because the NHS, understandably so, is so very stretched at the moment, there may well be a delay in actually getting those reports out to an individual. So just quickly wanted to also touch on key person insurance and business protection cover. So it may well be that some of you have this in place already, but if not, it's just something to potentially consider. So the pandemic that we find ourselves in the midst of reminds us of the value of our key staff. So it's worth considering, do you actually insure against the loss or long-term illness of your key people? People who'd be extremely difficult or time-consuming or expensive to replace, or people who may have unique training or skills or relationships or knowledge. Perhaps they're responsible for bringing new business in, bringing on board new clients, for example, and who would actually impact on the profits, viability of the business if they weren't there any longer. So as it says there, 70% of companies have never considered business protection, and actually it can be quite cost effective, quick and easy to set up. So just something to bear in mind. Private medical insurance is something that we've been having an awful lot of conversations with our clients about actually at the moment, because private medical insurance are annual contracts, and much of private doctors' time at the moment is being spent trying to support the National Health Service. So, what clients are asking is, what's going to happen with their private medical insurance? Well, we're hoping that some providers may well, we know of a couple at the moment who will provide, a couple of months cover for free if a policy is renewed, or perhaps will offer a slight discount into the following year, again, if a policy is renewed. But private medical insurance does also cover extra items as well. So it may well be that there's wellbeing support, there's perhaps employee assistance program or counselling, mental health support that's covered, virtual access as well to specialist consultations. So it may well be that you can have a virtual appointment with a GP. Some of the providers offer perks and rewards, so you might be able to get discounts or deals as part of being a member of that scheme. And also, if an individual were to be hospitalised as a result of having coronavirus, they would still be eligible for that NHS cashback under most schemes. And Vitality, for example, have actually enhanced their cashback amount payable just to continue to provide that benefit. Private medical insurance renewals is again a conversation that we're having with a lot of clients, because they're finding that almost a conflicting view within head and heart, I guess, as to whether they should be renewing private medical insurance policies as they come to renewal during the middle of this process that we find ourselves in. I think it's worth considering whether private medical insurance is a contractual benefit, because that brings about different complexities in itself. We also don't know if a company were to, for example, stop paying private medical insurance, they cancel the policy, what that implication is going to have if they decide that in 3 months' time, for example, they want to buy a new policy for their employees. The likelihood is this is probably going to have quite an impact on the market. It may well be that medical insurance becomes more expensive. So it may well be that an option is to scale back an medical insurance policy for now. The other thing, of course, to take into consideration is the reputation of to your employees. If it's a benefit that people really value and suddenly it's sort of taken away without notice, it's worth just considering the impact that might have, not only on their physical health, but also on their mental health, if it's something that they've become sort of reliant upon having that benefit. Health cash plan. So health cash plans, for those people who perhaps might not be aware or haven't come across them before, are ultimately, again, annual policies where you have an allowance that you can claim back under certain expenses. So things like optical, dental, chiropody, physiotherapy, for example. They can be either voluntary or employer funded, and they have annual claim limits. So whilst an individual isn't able to go out, for example, and have their eyes tested at the moment, they can still use the benefit if they know what their prescription is to buy glasses online, for example. And also, it is because it is that annual contract, there is still the ability to continue to use that plan, at a later date. Employee assistance plan or employee assistance programs tend to be included to some degree or another with a health cash plan. So if you have got a health cash plan, it is worth just double checking to make sure, have you got that in place? If you have, tell your employees about it, make sure they're aware of it, make sure they understand how to access it. Again, virtual GP services, some cash plans tend to have those included. So again, if people are concerned, I saw something in the media in the last couple of days to say there's a concern that people aren't going to the doctor about things that they generally would be. So cancer diagnoses, for example, are expected to drop because people aren't going to the doctor with things that perhaps they would ordinarily have gone to the doctor with. So whilst there are certain things you would still obviously need to physically see a GP, there is with cash plans sometimes a virtual GP service. So again, it's making sure employees know how to access that particular benefit. And then retail discounts. So people are still spending money, the delivery drivers are still being kept very busy. So if there are ways that people can get on to their cash plan, for example, or any other retail discount platform that you might have, and access those benefits, again, it's important to let people know. And the same rings true with the cash plan at renewal as it does with medical insurance. You know, we're waiting to sort of see what, if anything, will happen at the point that a cash plan policy is renewed. But it is, you know, these cash plans do tend to be relatively inexpensive for the value that they do bring, particularly if it's employer funded. It's just the tax cost that an individual would actually pay on the value of that benefit. So it would be easy for them to, over the course of a year, continue to use that benefit and value from that benefit as well. So employee assistance plan or employee assistance programs, these are probably more vital than ever, I would say. And the likelihood is that many of you will already have one, whether you're aware of it or not. So employee assistance programs ultimately provide support to an individual and in some cases their family members as well. So that if they are struggling, whether that be with stress, anxiety, some of them will cover an element of financial support as well in terms of guidance rather than any sort of lending facility. But there's a whole range of information that can be accessed to an employee assistance program. As I said, they can be purchased as standalone policies. You may have one as a standalone policy. Sometimes they are included as part of health cash plans, and sometimes group life or income protection policies will actually have them included. If you haven't got one in place, I would strongly recommend having a look at what you have got in place to see if there is anything included as part of that. And if you have got one, do tell your employees about it. Individuals' mental health, understandably, is really being quite heavily impacted. We've gone from sort of 100 miles an hour to slowing down quite considerably, almost overnight. And I think for people particularly who live on their own or who are very socially active people, it's likely to have a huge impact on their mental health. So I think if you have got an employee assistance program, it is really worth just making sure employees have got access to it and communicating that. Flexible benefits, again, has been something that is topical with us and our clients at the moment. We've got a number of clients who operate flexible benefit schemes whereby either a pot of money is provided to the employees to buy whichever benefits they want, or a platform is provided so that employees can purchase out of their own salary a range of different benefits at a discounted rate. The typical benefits that we would see that people would perhaps buy is things like additional holiday, gym memberships, travel insurance, discounted wills, and actually the impact on those is really dependent on the type of benefit that is in place. Travel insurance, they are again annual policies, so some people are still wanting to purchase the travel insurance through the scheme because it is generally speaking quite cost effective. But of course, we don't know when we're going to be allowed to actually utilise that again and be able to travel again. So for some people, they've perhaps bought an annual policy and again haven't been able to use the full year's worth of benefit because we have been restricted. And again, I think as time sort of moves on, we will start to see more of the insurers and more of the providers of these benefits coming forwards and letting us know, what they're going to do. Things like gym discounts. So some clients will allow their employees to purchase their gym membership at a discounted rate and pay that back through their salary. But obviously the gyms have been closed for around about a month now and, probably likely to be closed for some time yet. So I think it's just worth bearing in mind that, some of these benefits may be impacted and, work with your broker to speak to the provider of those benefits to say, well, what is going to happen? What does that actually mean? What is the impact on my employees? And, where you can try and preempt these things, communicate with your employees about them, let them know that you're looking into it, let them know that, you do all you can, rather than have disgruntled employees who perhaps are upset and, can sort of spread that message onwards. I think furlough has also been something that's been topical with clients because a flexible benefits platform would generally tend to have a total reward statement, and that total reward statement would include an individual's salary and also their pension contributions. And it's whether a client or a company decides that actually they want to change the salary that's within the flex system so that it accurately reflects the pension contributions, for example, during any particular period of furlough. Now, the reality of it is that it's probably, and this is very generally speaking, it will come down to individual companies, but it's generally speaking probably better to leave those as they are with the pre-furloughed salary, because the likelihood is a lot of your reporting will come from that system. And if you have to provide group life assurance providers, for example, with a report, if you then have the furloughed salary on there rather than the pre-furloughed salary, then it could then mean that people aren't actually covered for the right amount of benefit. So I think it's really important just to bear in mind, and just stop and think, I guess, in terms of what you're updating, in terms of your data, how you're updating it, and what the sort of ramifications, I guess, of doing so may well be. So employee support and communication, I think this cuts deeper than just talking to your employees about their pension and their benefits. I think we're all well aware that we need to be keeping in touch with our employees, keeping in regular contact with them, making sure that they're okay, making sure that, they have got details of any support that is available to them. But it is also a time where people, may have the opportunity to be able to review their pension benefits, to be able to stop and think about, well, actually, do I need to consolidate things? Am I aware of what I've got? Am I aware of what benefits I've got? This is your time to really communicate with them, tell them what they've got, remind them that, they are a valuable part of your business, and to reward them, you do provide, a range of benefits. So it's important to keep that regular communication going. I think if you are going to tell employees, for example, that you've got a retail platform, an employee assistance program, don't just chuck it all on one email, send it and think job done. Come up with a bit of a strategy, a bit of a comms plan. Think about what's topical at what time, when might you want to communicate, and how do you then continue to sort of regularly access that and make sure employees are aware. Even things like nomination of beneficiary forms on group life assurance and pension, making sure that employees are aware that, many of the pension providers now will allow an individual to actually go online and do it online, whereas historically it was done via, a wet signed paper form that had to be posted or scanned, whereas many of the pension providers now do allow an individual to actually go online and select it and make changes online. So I think just giving people, giving your employees gentle nudges and reminders of what they've got and what they can do, then is really important. So I'm going to hand back over to James now, who is just going to come on to a few final points.
Thanks very much, Steph. Yes, thanks very much for that. Some of what I was going to say is Steph has really just mentioned. If we move on to the next slide, your benefits need to be ever evolving, and if there's ever a time to review what you're actually offering and whether it's offering good value, surely now has to be a time to do that. You'll be very aware of what has been engaging for your employees, what they've been using, what they've appreciated and what's provided them with comfort, maybe even the group life scheme, God forbid, you know, to know that's there and that's in place for their family's support if the worst were to happen. This has to be a good time. We will get through it, but it has to be a good time to make sure that the benefits you're offering are appropriate. The benefits shouldn't be static. They should evolve. They should change over time. And I can remember one of my clients always saying they had a young employee that joined them, and they said if they're anything that isn't on their mobile phone doesn't exist. So you know, they want to be able to engage and access information very, very easily nowadays, and we're all becoming far more used to this as the lockdown continues. So you need to make sure that you are reviewing your benefits. Ask your employees what's important to them, survey them, benchmark your competitors, and work out what they're offering and whether you can do better. And then engage, educate, and communicate. As Steph has said, you know, that's the most important thing. Make sure that the benefits are understood, they are being used, and they're appropriate, and you're getting good value for money from them. So finally, we just like to just reiterate one or two of those points. The furloughing scheme, I'm sure there will be some tweaks to the way things are calculated and some of the dates maybe as it actually comes into practice, but do take care in doing those calculations. In particular, if you're using salary sacrifice, you're going to have to really consider in detail, you know, what is the employer contribution, and are you just, should it be left at the pre-sacrifice amount, and is the cost to the employer going to be the full employer and employee contribution? You know, do take care of those calculations, get advice where you need to, and review your contracts and agreements. I think I've just lost my screen. Can you still hear me?
Yeah.
Yeah, jolly good.
Yeah.
Okay. So yes, and review your benefits and continue to communicate and engage with your employees. So yeah, remember, this isn't forever. We will get through it, but more than ever, you know, benefits and communicating those benefits is important to your employees. And I know that the HR teams are great. HR teams are extremely busy at the moment, and working very hard to help all your staff. So thank you very much for joining us today. Thank you for your continued support for your employees, and do let us know. You've got our contact details there if you have any questions or need any further information, and we'd be very happy to help. Are there any questions that we can deal with now that have come up?
None at the moment. Has anybody got, if anyone has got any questions and you want to send them through, then do so. No, I think if not, we can pick things up afterwards.
Okay, Ruth, do you want to say anything? I think we're finished on time pretty much, 45 minutes, so that is
good.
We
have got one question, sorry, just coming through. So if a company takes out a life insurance scheme at the moment, are you seeing higher premiums?
We're not seeing higher premiums for renewals or new schemes at the moment. Clearly, it might depend upon the type of work that the individuals are doing, the type of work the business is doing, where they're travelling to, but or potentially going to travel to in the future. But no, life insurance is a very competitive benefit. It does have an actively at work clause, so clearly people will only be covered when they're sleeping there actively at work with the date the scheme goes on risk. So if you did have people that were off sick at that point in time, they wouldn't be covered until they return to work. But we're not finding that premiums generally are going up.
Another question, what would you say is the number one question you are being asked at the moment by clients?
It's an interesting one. Questions were definitely around furloughing and pension contributions and what's appropriate. We've had a number of different clients from even a range of different clients asking us that question. Most of them are just being cautious and are still applying the full contribution, despite the fact they can only reclaim the 3% of qualifying earnings, and they haven't tried to reduce it or reduce the definition of pay. But clearly it's an individual decision for each business. So that's one of the key things. And the other thing I think is just communicating the benefits about private medical insurance renewals. Steph, what would you think?
Yeah, I agree. I think pensions is really topical. I think people are, well aware that there is legislation that sits behind pensions to make sure that, they want to make sure they're doing the right thing. They don't find themselves being, fined or in trouble with the pensions regulator. And I think they also want to make sure that they're not doing wrong by their employees. So I think it's a case of, again, that balance between head and heart, actually, and that's what it really comes down to with a lot of employers at the moment, is how do they best make sure that they're supporting their employees with their pension contributions, doing things right, but not paying more than ultimately they need to, when finances are really key. But yeah, I think pensions is definitely something that's really topical at the moment. I think that's it for now.
Okay. Excellent. Well, thank you very much for joining us, everyone.
Thank you.
Yes, thank you, everyone. I hope that was helpful. And thank you to James and Steph.
Perfect. If anybody, as James said, if anyone has got any questions, anything they want to pick up afterwards, then do feel free to let us know, and just take care of yourselves, stay safe, stay well, and we'll hope to catch up with many of you when things return to some sort of normality.
Lovely.